Afternoon. Thank you. I'm Ann Dunkelberg with the Center for Public Policy Prize, and I appreciate the opportunity to testify on the filed version of Senate Bill 2. Obviously, there's a lot more going on in the HHSC budget than I can do credit to in 3 minutes, but I just want to touch on some of the key issues that we'll be visiting with all your staff about on HHSC very quickly in my allotted 3 minutes. So the first is, and you'll see on the front of your testimony, I have an infographic about the refunding of the Children's Health Insurance Block Grant by Congress, and been wanting to share that with members of the legislature because our congressional delegation needs to hear from you about the importance of getting that money funded. You probably had some very great materials in your packet yesterday from LBB and the Commission about that, but it probably didn't focus on the federal funds. But you may have noticed that the GR was dramatically reduced for CHIP on the presumption that we will continue to have our CHIP funding and we'll also get an increase in the match rate. So just wanted to provide you with this. I have some more detailed information I can provide to your staff as well, and hope that you'll reach out to the Texas delegation and encourage them to get that done, maybe even in March, which would give us all some reassurance in the budget process. The second is a refrain that you've heard from a number of speakers about, again, encouraging our legislature to take steps to close the Texas coverage gap. On the second page, you'll notice I have a small version, and I think another speaker is going to give you a big version of a nice infographic that describes the issue. And one of the things we found is that there's a lot of folks who don't realize that we have parents in a family of 4 at $23,000 who don't qualify for any help with their insurance and might have to pay, say, $440 a month for their premium. Their next door neighbors who earn $24,000 do qualify for subsidies in the marketplace and are getting a premium of around $45 a month. So this is this sort of crazy situation we find ourselves in, and this is why we encourage you to close that gap. I want to express support for HHSC's exceptional item number 1. And number 9, that's the one that at least has a small increase for our direct care workers in attendance. While I believe you had a presentation earlier about the fact that you guys, your aggressive attention to cost containment in Medicaid has in fact reduced the per capita cost for Medicaid recipients in Texas, and so no program can get away without some inflation factor, so we're certainly supporting that. The two other issues that are intertwined with appropriations but not directly on your plate are the rearrangement that will have to happen if we have a major reorganization under the sunset process. We're very excited about some of the provisions that Sunset identified, but we're concerned that a single agency may not be a silver bullet. We're concerned about whether and how you're going to be able to get the kind of talent you need to head up those agencies if they're really only division heads, whether you can attract and retain those people. So, and then the last thing I just want to say is that the combination of the sunset observations about Medicaid managed care, SB 7, and the need to renew our Levy 15 waiver, we hope that more attention will be given to making sure we have a comprehensive system of consumer supports for our Medicaid clients. Thanks.